This is your co-host Jasmine Quesada.
And I'm your co-host Paulina Gutierrez Hernandez.
And we're reporting to you from MicroMed8, bringing you urgent updates from the University of California, Irvine.
Yes, we're following breaking news this hour. A young female student at UCI has been hospitalized with a serious skin infection caused by Staphylococcus aureus, a bacteria commonly found in the skin and in the nose, but capable of turning serious fast. The National Library of Medicine defines staph as a gram-positive bacteria that can cause a wide variety of clinical diseases, and infections caused by this pathogen are common both in community-acquired and hospital-acquired settings.
According to earlier reports, the infection began as what looked like a minor skin irritation, but quickly progressed. Staph aureus is no stranger to hospitals and college campuses. The CDC estimates that around 30% of people carry the bacteria without symptoms, and if the skin is vulnerable, like cut or broken, this can be serious.
More concerning, some strains are antibiotic resistant, including the MRSA strain, making treatment more difficult. These infections send thousands to the hospital every year, and if left untreated, they can spread to the bloodstream or lungs.
We now go live to our field correspondent, ready to go at a safe distance because of contagiousness, interview an affected student. Hi, Mariana, are we live?
Good afternoon, I'm Mariana Sierra, reporting live from UC Irvine. Today we're shedding light on a common but potentially serious infection, Staphylococcus aureus. Joining me here today is...
Live? Hi, I'm Maddie.
Who has bravely agreed to share her experience with a staph infection. Let's start from the very beginning. When did you first realize something was wrong?
Well, it started with what I thought was just a small bump on my leg because I was shaving, right? Hot girl summer. But it looked like a pimple, so I tried to pop it at first. But within a couple of days, it got super red, super swollen, and super painful. And I was also feeling really tired, which, come on, it's midterm season. How am I not gonna be tired? And then I got a fever, and I continued to ignore it. But it also made me realize that something was kind of wrong, and I should probably get it checked out.
Okay. At what point did you seek medical attention?
Ooh, I'm a college kid, so I don't necessarily have insurance, but pretty much when I couldn't walk without pain, and I started getting chills, so I went to urgent care, which is gonna run you a good buck. Since I have a weak immune system, I got mono ones. I knew I couldn't risk waiting any longer, so they ran some tests and took a sample of the pimple area.
And what did the doctors tell you about Staphylococcus aureus?
Well, I'm no STEM major or anything, but they explained that it's a bacteria that normally lives in our skin, especially in moist areas what was it? Oh, the armpits and the nose, which I swear guys, I'm clean, I shower. And it typically doesn't cause problems, but I also read online that staph is what was the word? An opportunistic pathogen, which means that if waits for the right time in which my immune system is weak, and since I got mono, my immune system was so weak, it caused an infection, and in my case, the bacteria saw an opening and took it, literally.
Okay, that must have been very scary. How was it treated?
Dog, it was scary AF, girl. They started me with antibiotics right away. Thankfully, it wasn't the drug-resistant kind. I don't know, I read that somewhere. Known as, what was it called? Oh, MRSA, MRSA, is that the term? So the antibiotics worked, but they said if it had been MRSA, it would have been so much harder to treat because of resistance or something like that. I had to rest a lot, which, I did that anyways, and had to be really careful with the wound. Plenty of Netflix binging, don't worry.
Did they tell you exactly how you got the infection and how did it affect your day-to-day life?
They think the bacteria entered through my pimple, which don't do, by the way. Maybe from shaving at the gym, because gotta get those gains, guys. With my immune system already weak from the mono, my body couldn't fight it off. Since then, I've been way more careful. I wash my hands. I don't share personal things anymore, razors, towels. I don't even know why I was doing that anyways, ugh. And keeping my cuts clean, definitely. No more beach girl summers for me.
Thank you for that report, Mariana. Given that cases are currently on the rise in this community, we have a public health service announcement from a special guest here today to discuss this infectious pathogen and prevention methods so that you can stay safe from staph. Thank you for joining us today, Dr. Chavez.
Hello, thank you for having me. I'm Dr. Sonia Chavez, a microbiologist here to talk about a common but potentially dangerous bacterium, Staphylococcus aureus. Staphylococcus aureus, often referred to as staph, is a type of bacteria that lives on and in our skin and in the noses of about 30% of healthy people. When this bacterium gets into the body through a cut, wound, or surgical site, it can cause an infection ranging from mild to life-threatening. In order to understand staph, we need to know a little bit more about our microbiome. The microbiome is a collection of microorganisms such as bacteria, viruses, fungi, and even tiny parasites that live in and on our bodies. We could think of our microbiome as a microscopic ecosystem, and as any ecosystem, balance is key. However, when a harmful bacteria such as staph becomes too dominant in our microbiome, it could disrupt this balance and weaken our defenses, and in some cases produce toxins that damage our tissues. This is very problematic in hospitals where strains of MRSA, methicillin-resistant Staphylococcus aureus, pose a serious threat. So Staphylococcus aureus can be spread very easily because it is transmitted through direct skin-to-skin contact. It's transmitted through shared personal items such as towels, razors, and even contaminated surfaces. The good news is that there are effective strategies to prevent staph infections, such as washing your hands thoroughly and often, avoiding sharing personal items like towels or razors, disinfecting surfaces regularly, and following strict hygiene protocols and screening for MRSA when necessary in healthcare settings. Thanks for listening. I'm Dr. Sonia Chavez. Keep your microbes in check, and if in doubt, go see your primary healthcare provider today.
Thank you, Dr. Chavez, for that descriptive information on staph, teaching us the ways we can stay protected.
Yes, thank you, Dr. Chavez. That's all for now, folks. Stay fresh, stay clean.
We're your co-hosts, Jasmine
and Paulina
with MicroMed8 News. Thanks.